Hello, everybody. I want to welcome you back. Um, in this section, we are in section G, that is the infection control. We are going to do section D, which is infection control. Now, I have an entire course on infection control that is approved by the state of North Carolina. Okay, so at the end of this session, you need to be able to understand the importance of hand hygiene, demonstrate hand hygiene techniques, demonstrate alcohol based hand rub technique, and demonstrate the proper way of putting on and taking off clean gloves. So, all this will be done in the skills section when you come to see me face to face in the skills laboratory. Okay, so you need to understand what standard precautions is and for monitoring glucose, administering injections when what standard precautions to take when doing all that. Okay, so we're going to look at the handout, the G part of the handout, how to do, how to put things in the sharp containers and all that. We're going to take a look at it. So I want to ask everybody, pause this video as you are watching the recording. I ask yourself, what do you know about standard precautions? When you hear the word standard precaution, what comes into mind? It's very crucial that you understand what standard precaution is. It helps you in overall shell of what infection control is about. Let's look at the important infection control concept during administration of medication. Use sanitary technique when pouring or preparing medications into appropriate container. Do not touch or handle medications, but pour medication from the original medication container into a new or appropriate medication container. Do not touch it with your bare hands. I've seen nurses, med aides do that. But as you are coming in, do not practice that bad habit of touching the medication with your bare hands. Always have gloves on. Never use your own hands to administer medications and never require resident to have his or her own hands to receive the medications. Medications are provided to the resident in clean and appropriate medication containers. Okay. So when we talk about standard precautions, we have to observe standard precautions in our job settings. We have to wear gloves when there may be exposure to bodily fluids, mucous membranes, such as the vagina, the rectum, inside the nose, and the eyes. Cleanse hands frequently with soap and water or with the alcohol based hand rub. Hands should be washed with soap and water when visibly soiled. If there has been contact with bodily fluids before eating and after using the restroom, you need to wash your hands. Don't come out of the bathroom and immediately start passing medication. Wash your hands thoroughly before you put on gloves to pass medication. So, before and after you remove gloves, you have to wash your hands. Wash hands before and after using shared medical equipment. Now, when you are doing the vital sign machine is going to be just one equipment that is used for 6 patients if you are working in the family care home, or many patients, 15, 20 patients when you are working in the assistant living or the group homes. Make sure you are using wipes to wipes over the equipment before you move to the next patient's room to take their vitals. And you as well be using the alcohol rub on your hands. Gloves should be worn and hand hygiene must be performed when transdermal patch products are being administered. So nitroglycerin, Duragesic patches are applied or removed. You have to put on gloves to do all that. So the nicotine patches that you put on your resident who has smoking issues and must have nicotine patch, be sure that you are putting on your gloves to do all that. All right. Never administer medication from the same syringe to multiple patients. That is a big no-no. Even if the needle is changed, don't do it. Do not do it. All right. Do not reuse syringes to enter medication vial or solution. Do not administer medication from single dose or single use vials, ampoules or bags or bottles to more than one resident. And when you come to the skill lab, you see all those um, skills, and then you should be able to demonstrate. Dispose of used syringes and needles at the point of use in the sharp containers that is closable, puncture resistant, and leak proof. Never recap or bend or break needles. And don't put them in the regular trash cans. Don't do that. Don't do that. So when you come to the skills lab, every facility is different. The alcohol based rub product that you see over there. When you come to the skills lab, you see the alcohol rubs that we have. So we're gonna demonstrate how you put it on your hands and then waiting. Don't you rub hands palm to palm. Rub right palm over left palm of your hand with interlaced fingers and then switch. Rub palm to palm with interlaced fingers. You're gonna do that. Demonstrate that for me to see that. Rub back of fingers to opposite palm with fingers interlocked. In a rotational motion, rub left thumb while clasping in the right palm and then switch. In a rotational backwards and forward motion, you rub the left with the clasped fingers and then switch. So all this will be demonstrated when we meet in person to do the skills check off. You want to make sure you keep your fingernails short and clean. Do not work fake nails when you are working in the skilled facility, the adult care home. In the healthcare industry, period, you want to make sure that you keep your hands. We know that the caregivers we have in our time and age, they don't obey these simple rules. And that's why there will not be a chain of infection because the fake nail, the fake, all the jewelries and stuff that they keep on themselves, it harbors the germs. And this can be harmful to your residents. Leave your jewelries at home. Okay, the workplace is not a fashion place. Nobody is coming there or judging you by your appearance or everything. You just need to appear in your scrubs, and be decent and simple. As simple as that. The student, so you will demonstrate the hand washing and the hand rub when we meet in the skills lab. So hand gloves is the number one, the most common type of PPE. One when we are doing the medication administration. Okay, so non-sterile or the clean gloves, using different types, the vinyl, the latex free. If you're allergic, you have to use the latex free. It comes in different sizes, so always know your size, whether you are medium, small, extra large, large, and use it appropriately. So it should be worn once and then thrown away. Your gloves should be worn once and thrown away. Don't use the same gloves from one patient to the other. So from Miss Joey to Mr. B to Mr. Z, don't do that. That's cross contamination. That's so gross. Don't do that. Change gloves if your hands are going to move from body parts that is contaminated, dirty, to a body part that is not contaminated, clean. So even with one resident or one patient, you can change gloves like two, three times, and it's okay because you don't even want that same person to be sick. Change gloves right away if dirty or torn. And always double gloves. I always tell people always double gloves because the brand of gloves we have these days are so thin that it breaks easily. So always double gloves. Put on double gloves. It will help you. It will save you. Take gloves off carefully and do not touch skin or clothes with dirty sides of the gloves. Do not touch anything with dirty gloves that anyone may touch without gloves, like a doorknob. Don't do that. And then should be comfortable, not too loose and not too tight. Your gloves should not be too loose or too tight on you. When to wear your gloves? Wear gloves anytime you think you will come in contact with blood or body fluids, urine, stool or bowel movement, spit, mucus, the mucus that is coughed up. So I'll tell you simply, when you are passing medication, simply put on gloves. Okay. You don't know when the patient will be coughing and all that. So simply put on gloves. Wear gloves anytime you think you come into contact with non-intact skin, like sores, cuts, wounds, whatever. Okay. Wear gloves anytime you will think you will come in contact with mucous membranes, the linings, such like the rectum, the mouth, the nose. So the patient, some of them may have nasal sprays. Okay, just put on gloves. So examples of when to always wear gloves: when you might touch blood, body fluids, um, non intact skin or mucous membranes, providing or assisting with mouth care, wiping a nose that is draining, providing perineal care, the genitals and the buttocks, caring for resident with cuts and sores, performing a finger stick for blood sugar, touching a surface or equipment that is contaminated, may be contaminated. If staff has open sores and cuts on hands, okay. So when we meet in the lab, we're gonna don on gloves, which is putting on the gloves the correct way, how to do it the proper way, okay. Making sure you are using the one that fits you properly, and carefully making sure that the gloves is having no tears, holes, the scarlet spots. When gloves and gown must be worn, ensure that each glove is extended over the gown cuff. Okay, you have to ensure that. So I will demonstrate that for you to see when you come on. We will put on the personal protective um, PPEs, and then you show me how you put it over. You have to show me how to put it over. Okay. And then we will also demonstrate how to remove the gloves, grasping the outside. So one rule of thumb is that when you start your shift, after receiving report, you start your shift, you wash your hands. Make sure you get Clorox wipes, you put on gloves, you wipe all surfaces where you know you're going to be touching, all your residents' doorknobs, in and out the doorknobs. Clean it with Clorox wipes. Okay, clean it with Clorox wipes, and then the medication card where you're going to wipe everything down before you start your med pass is very crucial. So we will demonstrate how to remove the gloves. It's very important that you know your size of the gloves and always go for the one that is your size. So looking at the medication administration supplies. So when we meet in the lab, you will know, you will see all the things that you will see inside the facilities. We have the pretend medications, but you see more actual rest stuff that you come across with. Your medication card, you see it in the training video that I'm going to show you, or you've already watched. Um, you make sure you understand what each and every one of this is used for, the supplies. And always you want to make sure that prior to beginning to give medication, you must prepare your work area, whether that is the medication card, the medication room, the medication counter. Okay, wipe everything down, like I said. Gather all your supplies, have your gloves, have your trash bags, your sharp container by the med card. Start on a clean card. Okay, wash your hands afterwards before you start popping anybody's pill. The medication card or your work area should be stocked with supplies such as your alcohol wipes, little those little square materials saturated with alcohol. It comes in handy when you have to clean, you know, you have to perform, you have to clean the skin off before putting an injection. You can use it to clean your stethoscope before you check for the heart rate and the blood pressure. The inhalers, sometimes you have to clean around it a little bit. So these are all things that you need to make sure they are inside the med card before you start passing your medication. So lubrication that is used for the vaginal, all those lube tubes and everything, you want to make sure they are all in the cart and then they are all cleaned up. Your tape, your gauze, all those first aid kits that you may need when maybe as you are passing the medicine, there's something that is there that you need to clean immediately. All right. So your pill cutter, your pill crusher, all those have to be there on the med card. You don't have to be running from one unit to the other looking for a pill crusher, a pill cutter, or the tongue blades, the spoons, your drinking cups, your straws. Make sure those shuffle cups, your metered plastic cups. You want to make sure that your med card is always stocked and has everything that you need. Your water pitcher is filled with fresh water. Okay, those you will need the pudding for, those you will need orange juice, apple juice to help them swallow their medicines. We have residents that cannot swallow medicines with just ordinary water. They will need orange juice or they will need apple juice. So while you are working as a med aid, you are responsible for all medications. You must keep the medication storage area and the card locked at all times that you are not using it. You will keep the keys with you your entire work period, unlocking and locking each every time you step away from that area. If you are called away in an emergency, remember to lock the card or the area prior to leaving. Do not leave the medication keys to the resident or any personnel. It don't matter how you trust that person. Please don't leave the med card with them. Follow your facility's policies regarding maintaining security of medications. Okay, so the key points you have to take with you when in doubt, ask what to do if you are new in the facility. Whenever you leave your work area, lock the cart or the medication room, lock it because a wandering resident can open it and can pop some pills in their room, and guess what? They can die from it. You will lose your license. The facility will lose their licensure. Everybody is everybody is in trouble. So do the right thing and be responsible. Do not leave medication unattended on top of your med cart or the counter. Keep medication storage area locked to prevent unauthorized access to medication by resident or other staff. Throw away trash according to your agency policies. Keeping your work area free from trash will help you prevent the spread of germs. Cleanse hands often. Keep your hands clean at all times. From one resident room to the other. Use the alcohol rub once or twice. Then the third one, use soap and water. Keep all medication key issued to you on you at all times. It's very important. It is very, very important. All right. Administering medications. So this is where we use the six rights to administer oral, sublingual, topical, transdermal, eye, ear, inhalant, nasal medications. So right resident, right medication, right dose, right route, right time, right documentation. Identify proper action to take when crushing or cutting medication in relation to medication administration. All right. So you're gonna see the supplies when we meet in the lab room, the skills session. All right. We're gonna see all those. So when you go in to give oral medications, you want to talk to your resident. They are not robots, they are real human beings. Okay, they are real human beings. So ask them, how do you like to take your medication? How do you like to take your medication? Ask your resident that question. Okay, if they prefer only a few at a time, assist them to take 1 to 2 pills at a time. Remember to pour 8 ounces of water. Like we've spoken about it, in the other section, the previous section. You want to know if they can't swallow, or they can swallow but they have to take one at a time. Do the other resident and then come and do that person last. So encourage the resident to drink water. It helps them to stay hydrated all the time. Every time you are there to give medicine, encourage them to drink all their water, at least the 8 ounce that you've poured for them. This will make sure that the medicine will go down into the stomach. Giving the resident a sip of water before you hand makes it easier for them to swallow. Sometimes their throat are very dry because it's dried up because they haven't drunk water or any fluid. Maybe for a period of time for 3 hours they've not done that. Okay, so when we are doing the oral, we know that the tablets, they are hard. They are hard compressed medication. It can be round, it can be oval, it can be square shape. Some have enteric coating. Other types, they have the delay release and cannot be crushed or chewed. So always know what instructions is on there. Do not crush, do not chew. If that's the case, they cannot be crushing or chewing. If the resident has been chewing it, you have to let the doctor know. Let the physician know, their physician know, so they can change it to chewable things for them. So we know that the capsules, it comes in like a gelatin container. It may be hard, it may be soft. It dissolves quickly in the stomach. Absorption rates, something you have to know. Know the science behind the medicines you are giving. When administering oral medication, it is important to administer at the time prescribed or scheduled. Oral medications are absorbed or used by the body at different rates depending on various factors, such as if the content of the resident's stomach is empty or full. Okay, if that person has eaten a full meal, it may take time for the medication to absorb. If they are taking it on empty stomach, it may absorb very quickly. Understand these techniques. Cutting medications. So sometimes medications have to be cut in half to get the correct dose. This should be clear on the MAR. Use a pill cutter to divide a pill into half for the dose. Okay. If the pill cuts unevenly, then the pill is to be thrown away and a new pill is cut. Remember, if it doesn't cut exactly half and it cut into broken pieces, throw it away and get another one. Always clean the pill cutter with an alcohol wipes after using it so that the next medication aid using it will not be missing medications. So always clean after yourself. When you have used it to cut medications, always clean after yourself. Be careful not to cut yourself on the razor blade so you don't bleed into the medicine. Okay. Discuss with the supervisor if medication needs to be halved when the prescribed dose is for only half a pill. Follow the facility policy on disposal of other half of the medication. So remember, you need to know if you need to, especially if it's a narcotic drug, if you need to dispose of half of a narcotic drug, it might have in the policy that another aide has to be there. The nursing supervisor in the building has to be there to oversee it, or the administrator has to see it and show you how to dispose it. Never assume that you're supposed to throw it in the trash. They might have a container in the med room where you have to put narcotic half pill that needs to be discarded. If you don't do that, you'll be a suspect. They will suspect that you are taking the medication. Your license can be taken away from you for doing that. So always understand. So locate the device used for crashing medication, review the procedure for crashing medication, missing medications in food, and discuss various policies in the adult care home. So that's what we're going to do when we meet in person in the skill lab. We're going to crash some medicines. We're going to put it inside pudding or apple sauces, and we're gonna demonstrate how you give it to the patient in that form. All right. Every facility is different on their current list of medication, the do not crash medication list that you have to be aware of. So when you go to this website here, it gives you a list of do not crash medication list for safe medication practices. But your facility will have the list for you, the ones you cannot crash. And if there be a medicine like that in there, you have to let the doctor know. So crashing medications. Medication may need to be crashed if no liquid form of a medication is available and resident cannot swallow an oral solid medication. In the MAR, it should state if a medication is to be crashed. MedAid will not make the decision whether to crash a tablet or not. You don't make that decision, okay? The doctor has to make that decision. If it is not clear on the MAR, ask your the administrator if you are the supervisor there. Okay. If you are the supervisor in charge, ask the administrator. Several methods to crash a pill. So we have the mortar and pestle, that is the old age. We have the pill crushing device. You'll see some in the lab when we meet in person. Crash in 8 package. If only one pill is in the package, place between two clean paper medication shuffle cups and crash with the mortar, that pestle, or any other crushing device. We no longer use this mortar pestle thing. That's of the old time. After crushing medication, clean tools that come in contact with the medication with alcohol or soap and water. Be sure to dry them before returning them to the storage. It's very important. When a medication is crushed, it will taste bitter, and it's common to mix with small amount of food to help the resident tolerate the taste as they take now the bitter medication. So you can have vanilla or chocolate pudding or apple sauce. So mix the crash medication with a little apple sauce, not too much, just little, something little, as soon as possible, to make it for them to be able to eat it. The resident may not be able to eat it all or refuse to eat it all and thus not get all the medication. That's why you don't take too much, just a little bit. Never leave medication in food unattended because another resident may come by and eat the food, accidentally taking the medication, which will be a medication error and can be very dangerous, especially if it's a blood pressure medication. You know, you don't want that. Offer residents sufficient fluids following the medication administration of oral pills. If they were administered with food, offer more water to push it down. Observe the resident taking the medication to ensure that the medicine has been swallowed before documenting. It's very important. Not all medication can be cut or crushed. Do not ever cut or crush a pill that has enteric, the hard shell coating, or a capsule, or a pill that is sustained release or time release. Enteric coated pills has a protective hard shell coating that allows it to pass through the stomach without dissolving. So all these enteric coatings, these capsules, it goes into the small intestines, and that is where it releases its effect. So you crashing it into the stomach, it might not do a job properly unless the doctor gives the go ahead. So capsules and sustained release are to be observed over time. And if cut open, it will lose that feature. Okay. So cutting and crushing time release pills can result in the resident getting an overdose of the medication because it is absorbed it is going to get absorbed all at once instead of being released over a longer period of time. There is an extensive list of medication that cannot be crushed, however. Med aid are not to have to make a decision about cutting or crushing because instructions would be very clear on the MAR. All right. All right. Let's look at liquid medications. A common way to administer medication, like it comes in the form of solutions, suspension, syrups, elixirs. You need to be aware and to be extra take extra care not to make sure that you are measuring exactly what it needs to be measured using the measuring medication cup that has the 5 ml, 10 ml, 15, 20, 25, 30. Those measuring thing is there. So you always want to make sure you set it on a flat surface when you are measuring. Liquids may have administration requirements such as shake it well. It requires dilution prior to administering it. So always read, okay? Dilantin suspension must be shaken thoroughly before it settles and give inconsistent dosing. Something like potassium and bulk laxative must be mixed with sufficient fluid to decrease side effects. So always read it. So the types of liquid medicines, we have the solution, we have the suspension, we have the syrup, we have the elixir. So we'll take a look at the handout, um, and then we will see how they explain how to. So metered medication cap. So we have enough in our lab. You see how the measuring thing is always set it at a flat surface, and you'll be able to pour it and get the accurate measurement. Whether it's 15 ml you are pouring, whether it is 30 ml that you need to pour. Always put it on an eye level on a flat surface when you are pouring it, while covering the label with the palm. All right. Do not mix liquid medications together. Okay. Do not mix cough syrup with laxative. Don't do that. Never approximate the amount of medication to be administered, such as liquids. Always use the correct measuring device when measuring liquid medications. Never use household measurements or spoons, such as the teaspoons or the tablespoons, to measure medication doses because of inaccuracy. So your household, your kitchen tablespoons, and the your teaspoons, they are not the same as the one that the pharmacy provides. So always go for the spoons that comes with the medicine containers. Okay. To administer liquid medications, use a small, clear, graduated medicine cap, which you will see in the lab when we do our skills checkoff. So use a calibrated syringe for measuring liquids in amount less than 5 mLs and an unequal amount. Okay. Measure liquid on a flat level surface at eye level to make sure the amount is correct. When pouring liquid medication, hold the label under the hand so that the medication flows the from the side opposite the label, preventing the liquid from running down the container and staining, or obscuring the label. So you always want to pour it in, that you are not pouring it from the where the label is on the bottle. And I'll show you when we meet in person, because you want to make sure that you want to make sure you want to make sure that you want to make sure that you want to make sure that you are not pouring it from where the labels is, because the probability that some can drip from the tip and then go to where the label is, and it can obscure the reading. That's why you have to pour it from the opposite side of the tip of the bottle. So to prevent contaminating the remaining medication, never pour excess medication back into the bottle. I repeat, never pour excess medication back into the bottle to prevent contamination. Dispose of the excess medication per facility bottle. Dispose of the excess medication per the facility what policy is very important. Like I said, if you throw out an advent, half of it without no anybody seeing when you threw it, where you threw it at, they might charge you for, you know, you might be accused of taking that medicine yourself, that half pill. God knows you didn't put it in your mouth, but guess what? Nobody is your witness. Nobody saw you. So who would believe it? It's your word against what you were supposed to do. So always do the right thing. Always do the right thing. Go according to the policies of disposing of medication. Ensure resident is sitting upright before administering liquid medication. They can aspirate on it. They can choke on it when they are lying too low in the bed. So always make sure they are sitting at least 45 to 90-degree angle on their bed so that their head is straight, everything is straight out, not tilted, so they don't aspirate on it. When you are doing the liquid with a dropper, some medications come packaged with a medication dropper with measurement on the side. If a medication comes with a special dropper, use that dropper only when giving that medication. Don't use that dropper to go and pour another medication. Don't go and put it in another medication to draw it out. Don't do that. Keep the dropper with that medication that it came with. Some manufacturers have you replace the cap with a dropper so that it's always ready for use to prepare the correct dose. So don't interchange it and go put it in a different box. Don't do that. Liquid medication may have an oral dropper or syringe specifically for measurement of the dose. The name of the medication, the strength, will be printed on the dropper and should be used only to measure that medication that is identified for that dropper. Be careful and note measurement on dropper are in milligram or ml and prepare resident dose appropriately. Increased chances of making a dosing error if a different measuring device is used is very, very common. So always remember that part. When using a special dropper to administer liquid, draw up the accurate dose of med and put it into the medication cap to deliver it to the resident. Do not use the dropper to give the resident the oral medication because that will contaminate the dropper and in turn it will contaminate the remaining liquid in the medication. So when you squeeze with the dropper and get the accurate measurement, don't go and put it inside the resident mouth. This is what it's saying. Put it into a cup and go give it to the resident. So we will look at the skill sheet on how to administer oral and liquid, the solid and the liquid medications when we get to the lab. Okay, let's look at sublingual medications. Let's look at sublingual medication. So you place the medication under the resident's tongue. Instruct resident not to chew or swallow the medication. Do not follow with liquid, which might cause the tablet to be swallowed. So um, don't immediately give them water. Let it be for some minutes. Let it be for some minutes. So when we meet in the ref- when we meet in the lab, we will do that demonstration. Oral inhalers. So spacing and proper sequence of different inhalers is important for maximal drug effectiveness. Okay. So whenever you give one, you know, you give it a minute or two before you do the next one if they have two of them. The prescribing practitioner may specifically order the sequence of administration if multiple inhalers are prescribed. So sometimes it says that give 5 minutes interval, shake all metered dose inhalers before use, and shake between puffs. Okay, you shake it between puffs. So when we meet, you will see, you will demonstrate with the puffs and you do the shaking too. Wait at least 1 minute between puffs for multiple inhalations. Okay, so we will do the demonstration in the lab when we meet. We have the eye drops and ointment. Wash your hands prior to and after administration of eye drops and ointment. Don't say, oh, but I didn't touch the eye. I didn't. Always wash your hands. Wear gloves. Okay, wear gloves. Some people may have an infectious um, thing in the eye. When your hand touch it, your bare hand touch, it's not good for you. Okay, and your hand may be contaminated and you make the person more sick when you accidentally cut their eye. Don't do it. Put your hand gloves on. So always wear gloves when there is redness, drainage, possibility of infection. I would say always wear gloves. It don't matter. Wait 3 to 5 minutes period between medication when two different eye drops must be administered. I repeat, wait 3 to 5 minutes. Do not touch eyes with dropper or medication container. Do not touch their eye. You're going to cause irritation to them. It's very important. All right. Wash hands before and after administration of ear drops. Always put on your gloves. If it's an adult, gently pull on the ear, straighten the ear canal. Request the resident to remain in the same position for 5 minutes to allow the medication to penetrate. Okay, they shouldn't move about after that. Gently plug the ear with cotton to prevent excessive leakage if necessary. All right. The nose drops and the nasal sprays, inhalers. Wash your hands as usual. Put on your gloves. Always put on your gloves. For the drops, residents should lie down on his or her back with head tilted. Request the resident to remain in that position for 2 minutes to allow sufficient contact of medication with the nasal tissue. If it's a spray, hold head erect and spray quickly and forcefully while resident sniffs quickly. Have the resident tilt head back to aid penetration of the medication into the nasal cavity if necessary. Wipe dropper or spray with tissue before replacing the cap. You have to wipe it. That's very, very important. Wipe it with alcohol, the alcohol pads. Okay. So when there is a transdermal, always put on your gloves. Always put on your gloves because the medicine can get on your fingertips. Rotate application site for transdermal patches to prevent irritation. Document application site on the MAR. If the patch is ordered to be worn for less than 24 hours, document on the MAR that the patch was removed and the time it was removed. Wear gloves and wash your hands after patch is applied or removed. When a patch is removed, clean the area to remove residual medication on the skin. Clean it with the alcohol wipes, the alcohol prep, the square thing. All right. So topical medication. So you always want to wear your gloves. Use tongue blade, gauze, cotton tips, applicator to apply medication. So there might be a skin scratch, some skin tear. Okay. Use a new applicator each time medication is removed from the container to prevent contamination. Don't use the one that you've already used and put it back into that medication container again. Provide privacy at all times. Place the lid and the cap of the container to prevent contamination of the inside surface. Do not discard gloves and supplies in areas accessible to residents. Okay. Don't put it where a resident who is confused can put their hands in and dig something. Okay. It's very, very important. All right. So, how to administer insulin injections? So we so this one is a little optional. However, it's good to learn. But I would like you to know how to do that demonstration. It's definitely important that you know how to use your insulin injections. It's very, very important. Okay. So, you know, um, when you have a diabetic, you may never know when you have a diabetic resident in that adult care home. So, it's good to learn it. So even though it's optional, it's good that you know it as a med aid working in the group homes or family care home. Always remember, never recap a syringe. Dispose of syringes in the appropriate sharp containers. Wash hands before and after gloves. After you are done, you wear your gloves. All right, we are looking at this is the last session, ordering, storage, and then disposal of medications. Okay, so as a student, you need to be able to describe procedures for ordering medications and ensuring medications are ordered, are available for you to give it to your patients at all times. You have to be able to describe where you will store and secure your medications, and then keeping inventory of your controlled medicines. Okay, what are the controlled medicines? The morphine, the hydromorphone, oxycodone, and the rest that are in the category 4 of controlled medicines. Identify the procedure for disposal of medication. So when you come to the skilled lab, we'll look at all these forms that we have in demonstrating how to get rid. But every adult care home is going to be different. Okay, every adult care home is going to be different. You need to be able, during your orientation and getting hired at that place, you want to make sure that you ask them, how do you order medication when it's out of stock? Where do you store medication when it needs to be stored, other than the med card? They will show you the med room, you know in the fridge. The fridge may have a key. Yes, the fridge may have a key. If it has a key, where is the key stored? The pharmaceutical number that you will call, which extension to dial, the facility code to give them. You need to know all these things. Each adult care home will provide orientation, like I said, to avoid medication error resulting from med availability. There must be a system for ensuring reordering and delivering of resident medication. Medication supplies must be monitored and regularly it must be monitored regularly and reordered on time. If a medicine is not available, an effort to obtain the medicine must be made and must be documented. Notify the pharmacy, the supervisor, and if you are the supervisor in charge, notify your administrator. Let the doctor know. The family has to be aware as soon as possible so they can get things done. Go according to the facility policy. Don't bypass protocol. It's very important. Storage of medications. Medications has to have storage areas like the med card, the medicine room, and it need to be ordered, in a manner where it's easy to be found and time not wasted when a patient needs their medicine. Store medication in a locked area unless medications are under the direct supervision of staff. Direct supervision means that the card is in sight, and you, as the staff, you can get to the card quickly if necessary. Lock the medication room, the medication card, the medication cabinet when you are not using it. It don't matter. Lock it at all times. Unless the medication room storage area is under the direct supervision of you, you are already around that area, you are doing something. That's why you are not locking it. That's fine. If not, keep it locked at all time. Store external and internal medication in separate designated areas. Medicine that needs to be refrigerated must be in the refrigerator at all times, and it must be locked if stored, so that no other staff who doesn't have any responsibility of giving med should have access to it. Store medications requiring refrigeration at 36 degrees to 46 degrees. Okay, it's very important. Controlled substance. Review the regulations for storage of controlled substance. Correctly, signing out on controlled substance and reporting of any discrepancies discovered. So don't take a key from a med aid or a nurse if the med count is incorrect. Grab whoever is the overall boss. Let them come, let them sign on it that when you were taking the keys, this was the amount. If something is missing, so they will not. Never you trust any nurse, any med aid, and say, "Oh, I counted it before leaving," and they left before. Maybe you were running 30 minutes late. I left the key here. I counted everything. No, don't accept it. Do not go and clock in for that shift because you'll be in trouble. Controlled substances have to be counted by two people and a third person involved if the med count is not right. They are kept locked most often in a special location or a drawer in the med cart or in the medication room. Med aid must make sure the number and amount of medication listed on the controlled substance log or the form is correct before removing any medications for the resident. This is called the count. So always make sure the count is right. When a controlled medication is removed, the amount removed must be documented and the number remaining must be counted and that number recorded. So whatever was the balance after the shift of that person should be recorded, and it must match the number of medicine. The facility must have a readily retrievable record of controlled substance by documenting the receipt, administration, disposition of controlled substances. It's very important. Your license is at stake if controlled substance are always missing something on your shift. For each controlled substance, there is a facility system in place to track how much was delivered from pharmacy, how much was on hand when the shift started, how much was used even to the resident, who the resident was that received the medicine, who gave the medication, how much was left. Reason a resident receive a PRN control such as pain. Some facilities have a sheet for each drug. Other facilities has a notebook for controlled substance. For whatever reason it is, there has to be documentation of controlled substance. Don't receive verbal report from anybody. Not even the administrator should make you do that. You will lose your license for it. Periodically, the controlled substance are counted, usually by two people at a shift change, and med aid may be held responsible for missing medication on shift. So that's what I said. Protect that license that you're going to get at the end of this class. Controlled substance may be stored in one location in the medication card or medication room. When Schedule 2 medications are stored in one location together with other controlled substance, the controlled substance are to be under double lock. Okay? When controlled substance, including Schedule 2, are stored with the resident's other medications, only a single lock is required. There must be a readily retrievable record of controlled substances by documenting the receipt, administration and disposition of controlled substance. Very important. Okay. So review procedures for disposal of medications when it has been opened and prepared but not given, and teach the procedure. Your facility has to do that. Okay. So disposal of medications, there has to be reasons for disposal of medication, and that can include that the resident refused after medication was prepared, medication was dropped on the floor or contaminated, medication has expired, medication has been discontinued by the prescribing practitioner or the doctor. Dispose of dosages of medication that have been opened and prepared for administration and not administered for any reason. Dispose it promptly. Medication discontinued or expired are destroyed or returned to pharmacy in accordance with the facility policy. Regulations require records be maintained for medication destroyed or returned to pharmacy. It's very important. The state might look into all that. Regulations and procedures for destruction or disposal of controlled substances will be different from other medications. So take note of that. If training if training is facility specific, discuss the facility's procedures for the disposal of the medication. Well, if you have any questions about what we've learned today, um, don't hesitate to let me know, and I will be glad to answer. If you are taking this online, you bring all your questions to the skill session, and I will do my best to answer all of it for you. All right, I'll do. So, the key takeaways from this class: safety, accuracy, know your six rights, documentation, document appropriately, going according to the facility policies and procedures, and the biggest one overall, infection control. Don't use any dirty, stinking hands. Okay, do not use any dirty, stinking hands to give medications to anybody. All right, and be sure that you are documenting appropriately. So that's the end of the class. You're gonna do the skills validation, and you're gonna take the exams for me, and then I'll issue you your certification. 60 days after the skill validation, you should register to take the state board. All right, I'll email you the link. You should be able to go there, register, and then take the. Whilst the thing is fresh in your mind, go take it so you don't forget it. Don't waste too long time to do it. Go take it whilst it is fresh in your mind. All right, it's been a pleasure teaching you, and my hope is that you become one of the greatest married and even be able to further your education and do more with it. All right.